Hi, Paul Slatkus, Good News Broadcast. I'm speaking to Dr. Gary Henschen. Hi, Doctor. How are you?
Hi, how are you? I'm fine.
Good. Chief Medical Officer for Behavioral Health at the Magellan Health Services and a veteran of the U.S. Army. And thank you for doing both of those jobs.
Thanks.
Michelle Joyner. Hi, Michelle. How you doing?
I'm doing real well. Thanks for having me.
Good. Communications Director for the National Military Family Association. Okay. So Take Mental Health to Heart campaign. Actually, Michelle, why don't you tell us about it?
You know, Take Mental Health to Heart campaign is an initiative from Magellan Health Services and their partner with Horizon Healthcare Services as well, that works to increase the awareness that military families need for services that are in their community, and also lets the community give back to military families through a campaign they've got online to donate $1 up to $50,000 to our association for every e-card that folks send.
Oh, okay. So they go to a website. Is it this Take Mental Health to Heart, or they go to a YouTube site? Where do they go?
They go to takementalhealthtoheart.com, where they can find information on mental health care services that are in their community and ways they can help, and click on the links for the action that they want to do, and it's easy as that.
Okay, I'm looking at a nice website. Send an e-car, screening tools, okay. Grief and healing coming up. They're going to be talking about that. Doctor, how did Magellan get involved?
Well, Magellan has been very interested in the issues related to our heroes in Afghanistan, Iraq, and elsewhere. And so we formed this partnership with National Military Family Association. We have several programs across the country where we outreach to our active duty heroes and veterans. And this is just a natural extension of what we do. Magellan's very involved in mental health prevention and mental health treatment, and we felt this was a natural direction that our company would take.
Mm-hmm. Michelle, you know, the military is, mentally draining, right? Physically, mentally, emotionally, and so much more, right? When someone either serves here or serves overseas or whatever, the potential of, not feeling so good after something like this is probably pretty prevalent, isn't it?
It's been a long war. 10 years at war has really taken its toll on military families and our service members as well. And there are a lot of great resources, but families need to know about them, and they need to know where they can go to find support. I mean, when somebody is deployed, not only are you worried about their safety, obviously, but it's taking on a lot of additional responsibilities at home, oftentimes being a single parent, being separated from your family, your extended family, and having that support system. So it is mentally draining and challenging. It's a rewarding lifestyle, but obviously has its ups and downs.
Mm-hmm. Actually, we've done quite a few shows on with military returnees, and a lot of the situations are good, and some of them are quite concerning, even homelessness.
Absolutely.
After serving the country, and not to mention past veterans, right? We've done quite a few shows with the USO over the years. Why do you think that is? Well, I mean, we're many people think a leader in trying to keep peace on earth, let's say, and as you interview soldiers, their mindset is, it's for safety and for peace, and then they sort of come home and not treated as as nicely as they could be.
We're very fortunate that we have learned the lessons from the past, and that folks are able to separate the service of the service member from their political views. But another thing that's different about this war is the multiple and repeat deployments, people going back time after time after time. And while we focus a lot on the very heartfelt homecomings, we don't really think about what happens after that. And it's bringing that family back together, creating a relationship and bolstering that relationship, and renegotiating the dynamics of that family unit, because no matter what you do when you go overseas, you're going to come back a different person, and it's all family members are going to change some and come back with wounds, both physical and invisible, that need time to heal.
Okay.
That's why I think this is such a great initiative to be promoting. So definitely appreciate it.
Dr. Henschen, let's talk. You're a Chief Medical Officer for Behavioral Health and a veteran. As a veteran, were you in part of helping with behavioral health of the U.S. Army?
I was when I was a veteran. This was when I was on active duty back in the 70s. I was a flight surgeon and a commander of a health clinic. And I was deployed to Germany, where we had a lot of mental health issues. But at that time, I had no mental health training other than medical school and training in internal medicine. And so I was faced with having to get mental health resources or to develop them myself in this very isolated part of Germany during the time of the peak time of the Cold War, where there were a lot of stresses on our active duty and our families. So that was my experience prior to training in psychiatry, which I did after my active duty experience.
So now, what do you see as in Magellan being a very well-known and successful and honorable, obviously, company here? What are you dealing with?
I think several different things. Supporting, first of all, military families, making sure that they know what resources are available, and also giving them some techniques to approach their service member, to encourage them to get help and to identify the need to get help. Many of our service members, after their deployment, come home and develop symptoms of things like post-traumatic stress disorder long after they return from home. Or another issue is mild traumatic brain injury. When a soldier leaves the theater, they receive a screening, and sometimes the screening doesn't pick up the symptoms of mild traumatic brain injury. They may not even emerge until weeks later after they return home. So I see those as two of the major issues clinically with our returning veterans. But also providing the family support, teaching the active duty service member how to look for mental illness. But I think the main thing is a problem that we see throughout society, but especially in the military, is overcoming stigma. Many of our service members don't seek help because they're fearful of stigma. They're fearful of being criticized, or that it might affect their promotion or their military career if they were to seek help. So we've got to educate them that this will not happen, that they need help, and that the family can be a very effective tool in assisting the service member in overcoming some of these fears of seeking help.
Paul, if I can add something.
Sure.
Like Gary was saying, there is most cases are discovered by the family member who notices that something's different, somebody's acting different, something has changed. But it's very difficult for the family to know what's normal and what's something that's really gone outside of the boundaries. And what is so great about Take Mental Health to Heart is that those type of resources are available online, those type of checklists and what to look for, and what are some action steps that they can take if they notice that somebody that's very close to them might be suffering from something like post-traumatic stress disorder, or might have some complications due to traumatic brain injury. And so we're very thankful that these type of resources are now available for families when they weren't years ago.
So step one, what does someone do? I mean, I know we go to the website, and where will it direct us to go? Is this someone who has insurance already, who can utilize their insurance, or is this somebody that doesn't have insurance, or is this something that that the government isn't still doing anything or taking care of?
Well, definitely, if they're still active duty, there is a very robust insurance plan. And then for our Guard and reservists, they might have resources through local community programs like that Magellan offers. And the insurance bit, of course, is going to depend on each person. But what's important is to know when to ask for help, and that's what this website does. Is it tells you what's normal, what's not, what type of steps that you can take to seek help, and how to act if there's an emergency situation.
Okay, well, very important, very important. Well, thank you both for doing what you're doing and coming out and helping such well-deserved people here. Last question, then. What's good news for each one of you?
Well, that a program like Take Mental Health to Heart is reaching out to thousands of military families and giving them the help and the assistance that they need and that our heroes deserve.
Michelle?
Absolutely. Good news to us is that the community at large is taking notice of the service of military families that's alongside with the one who wears the uniform. So having communities step up and provide support is a welcome day.
Okay, and thank you both for coming out and speaking about it. We're honored to get the chance to share this with our audience. Thank you so much.
Thank you.
Thank you.
Take care. Bye-bye.
Bye.